just because something is happening right now does not mean
Mm-hmm.
that it's going to happen forever. Just because you're having pain right now, first of all, you shouldn't. It's not normal. You should not have pain with breastfeeding. You should get help. But just because there's pain right now does not mean that you're going to have pain if you're planning on nursing for 2 years. Just because you're having issues with supply doesn't mean that you can't change that. But the earlier you get help, the easier it's going to be for most things with
Right. Welcome to the Cyclical Doula podcast. I'm Emma, a certified fertility awareness educator, miscarriage doula, and the founder of Emma LLC. This space is for women who want to understand their bodies deeply, not just memorize information, but actually feel confident in interpreting their cycles. Here, we talk about ovulation, hormones, cervical mucus, basal body temperature, and all that messy in between emotional layers that come with being a woman. We talk about trying to conceive, avoiding pregnancy without hormones, postpartum transitions, pregnancy loss, perimenopause, and everything in between. Because body literacy isn't just about charting. It's about the autonomy. It's about informed consent. It's about not outsourcing your reproductive decisions to guesswork or fear. Each week, you'll hear conversations with women's health professionals, birth workers, educators, and researchers, along with solo episodes where I teach practical skills you can apply to your own cycle right away. If you have ever felt like you should have learned this information sooner, if you have ever felt disconnected from your cycle, if you want to raise the next generation without shame around their bodies, you are in the right place. So grab your tea, open up your notes app, and let's build cycle confidence together.
Welcome to the space where cycles breathe, where the real raw life of Emma leads.
Today, I am really honored to be joined by Sarah. Sarah is a naturopathic doctor, a board-certified lactation consultant, and the founder of Your Downtown Doula. She's also a mom of 2 boys. For nearly a decade, she's been supporting families through pregnancy, postpartum, and that often overwhelming transition into parenthood. I am so excited to have this conversation, knowing that Sarah's work is in her commitment to informed choice, confidence, and honoring the fact that only you know what's best for your family. So I thank you so much for being here. I'm so excited to have this conversation with you and dive into so many things today.
Yeah, I'm so excited to be here. Thank you so much for having me.
Absolutely. So can you share a little bit more for our listeners just about like who you are as a human being?
Yeah. So I am, like you said, a naturopathic doctor and a board-certified lactation consultant. I also do infant craniosacral therapy in my practice, which is like a lot of things, a lot of like stuff that just means I like live and breathe babies. I like
Yes.
babies, postpartum recovery, pregnancy, like that's just my jam. I've been doing this work for almost 10 years, which is crazy to me. Yeah, I have 2 kids. I've been
That's
there.
amazing. Yeah, for sure. I love that. I think like I feel like once you get into the space of like working with a family postpartum and like with those infants, like you said, like you're doing infant craniosacral stuff now too, like that like as you learn more about how you can support them, you're like, okay, like I need this other information to be able to support them better.
Yeah. And I feel like it's just like one rabbit hole after another rabbit hole after another rabbit hole of like, there's so much information out there. But I really like to think that I do kind of like whole family care. So like, the naturopath piece is, that's like the hat where I look at like postpartum recovery, like mental health, that kind of stuff. The lactation piece is like the feeding. And then the infant craniosacral therapy is like, how do we take care of the baby?
Yeah.
Yeah.
So good. So what kind of brought you into this work specifically?
Yeah, that's a great question. Kind of by accident, honestly. Like my one of my co-founders was just like while I was still in school, I started in physics and then hated it so much, and then went into naturopathic medicine because I had a colleague when I was like working a lifeguarding job as a teenager. She went into naturopathic medicine and she like told me all about it, and I really loved it. So I dropped out in a master's in physics and went into naturopathic medicine, which is like not at all the same thing.
Yeah.
And then while I was in school, one of the co-founders of my company was like, I think there's like a weekend doula training. I think you would really love it. You should do it. And I was like, okay, it's like right beside my house. It was like really cheap for students. I was like, I'll do it. And I was like totally hooked on it. After the first birth I attended, I was like, this is the best, like the oxytocin hit of being around babies. And then one of my really early clients like really struggled with breastfeeding, and I just like did not have the tools to help her. And I
Right.
feel like as a naturopath, like we're looking at the foundations of health. There's nothing more important to the foundations of health than like optimizing breastfeeding for babies. So that was what triggered the start of the lactation journey. And then now here I am like 10 years later.
Doing all the things. That's
Doing all
amazing. I love that.
Yeah.
So you, I'm sure, have seen so many families that you've supported over the last decade or so. Is that right?
Yeah,
That,
like probably over 1,000 babies. Is my
yeah. Amazing. So what do you think most parents feel like the most unprepared for when they enter into this postpartum time of their...
Yeah, I mean, I don't see the people where feeding is going well. So
Yeah. Well,
I
that
hear
makes sense.
all the time, like people are like, I thought I was prepared for like the birth, and I spent so much time working about like the birth, which is important.
Right.
But then I didn't realize breastfeeding would be so hard. I hear that all the time. I didn't realize breastfeeding would be so hard. I thought it was just natural. Your body just does it, which is like not how it works a lot of the time. A lot of the time, sometimes it does. That's great,
yeah.
but like not all the time. So that, and then I think anything to do with infant sleep is also like people are like inundated with information about what is supposed to be happening versus what is happening. And like a lot of the times that information doesn't jive with like proper feeding advice, and then so their expectations are all like it's just overwhelming and confusing, and like people don't know how to get good information. So like feeding and sleep for babies are like the two probably most stressful things. And then I feel like because people are so stressed about those things, like taking care of yourself kind of falls off the chart.
Sure. Yeah, absolutely.
Yeah.
Which then I think like spirals into this for many people, especially first time parents, like spirals into this like guilt of not feeling like you're doing enough or all of those things.
Yeah.
What do you feel like you again, like you have a niche of like people who are looking for support are coming to you. So I'm sure like that's part of it. But what are you seeing in society that's coming up for people in those early weeks around just how moms are reacting to being parents?
Yeah, I mean, there's like oh my God, so many things, so many things come up. Part of it is that like people feel we put so much pressure on ourselves, and especially too if you're like in the corporate world or you've been working a full-time high stress job, and then all of a sudden you're like not, and you have so much control in a workplace, and with babies you just like don't have that.
Yeah,
Or like maybe you don't have all the control in the workplace, but like with babies, you truly, really do not have control over. And so like there's a piece of like a lot of anxiety of like giving up some of that control, giving up some of that perfectionism. Like you really have to work with the baby that you have with you, and different babies have different personalities. So like what works with one baby might not work with the next baby in the same family, even though it's the same parents,
Right.
So just like navigating, trying to do everything right, and having some grace for yourself, I feel like that's a big one. And then also just so the expectations you have on yourself, but also the expectations that other people put on you, right? Because for the whole of your life, your mom is the mom. And then when you have a baby, all of a sudden in one instant, you are the mom. And so like trying to figure out that because there's new relationship dynamics and advocating for things that you feel are important and like all of this dealing with the expectations of family members, all of those things are like an additional layer of stress on top of the
Right.
stress we put on ourselves.
Yeah. Which
Yeah.
is so much. And I think like that overwhelm doesn't help with all of these other things that are taking place of figuring out how to sleep at all and how to take care of ourselves. And then, of course, a lot of the things that you're doing too is about feeding and breastfeeding and all of those things, which can be such an emotional experience for people.
Truly, yes. Yeah.
Yeah. What do you wish people understood more about like going into that feeding experience?
Oh, yeah. One of the biggest things actually is you're in the States, right? Are you in the States? Yeah. Okay. So it's true in Canada. It's maybe a little bit different, but it's certainly, I think this goes across the border.
Yeah.
The goals of working with somebody in the hospital are going to be different than maybe what your goals were going in and what your goals are once you're home, right? So like if you are in the hospital with your baby, the primary goal of both you and the lactation consultant you're working with is to not be in the hospital anymore, right?
Right. Right.
And really, right? And sometimes that means that you're maybe like making decisions that aren't necessarily like favoring long-term breastfeeding goals or long-term feeding goals in
Mhm.
general, but they're important to like get out of the hospital. But that doesn't mean that that's what you should necessarily be doing or need to be doing if you don't like it for the whole of everything, right?
Yeah.
And there
Yeah.
are things that you can do to protect your supply or protect how you're the latching and things like that. So like even just asking the question of like, okay, this seems like it's maybe not necessarily going to protect my feeding goal where I'd like to make sure that I have enough supply for 6 months or be directly feeding from my body. Like, is there other things that I can do that are going to make that more likely in the future, even if it's not happening right now because we're in the NICU or whatever. Like because the nurse is not going to necessarily have that long-term thought for you. So
For
just
sure.
having the like ask a long-term question. Um, and also to like just because something is happening right now does not mean
Mhm.
that it's going to happen forever, right? Just because you're having pain right now, first of all, you shouldn't. It's not normal. You should not have pain with breastfeeding. You should get help. But just because there's pain right now does not mean that you're going to have pain if you're planning on nursing for 2 years, right? Like just because you're having issues with supply doesn't mean that you can't change that. But the earlier you get help, the easier it's going to be for most things with
Right.
lactation.
Absolutely. Which I think is so helpful. I think like before I had my first kid, we lived in Vermont at the time. So a little bit more of like a natural, like crunchy kind of atmosphere. Yeah. And so there was a resource to take a breastfeeding class beforehand. And
Right.
we like did the thing. I feel like even though I learned a good amount of information there, I felt like it still didn't like prepare me enough to like know anything. And I'm one of 5 kids. Like I saw babies be breastfed. Like it was not like something like brand new to
Unfamiliar.
me. And I was like, this is mind
Hard.
boggling
Yeah, it's
and
hard.
hard.
It's hard.
Yeah.
I was studying to become a lactation consultant when I had my first, and I was literally like
Yeah.
doing hands-on help with other people. And
Right.
still the first time I did it with my baby, I was like, "Oh, this is happening." And I was like not prepared for that. Like
Right. Yeah. It's a lot. And I think like I'm so thankful that there's so many different types of lactation consultants out there to be able to support so many women. And then also I feel like there's so many people who still don't know that this is like an option of support that they can get, which is the duality of that is hard. Is there anything like other than taking like a class, is there anything that you do or like would promote for people to do before, like maybe during pregnancy, before breastfeeding that could help them prepare as
Yeah,
best
I
as
mean,
possible.
a class is going to be your best. A class is going to be your
Yeah.
best bet. And then if you have other people in your life that have babies, just hang out with them. Be like,
Yeah.
truly, just be like, can I see you feed your baby though? Can I hold your baby? Because lots of times, if you're not one of 5 kids,
Yeah. Right.
people are like, I haven't held a baby
Yeah.
in my adult life. This is the first baby I've held, and it's my baby.
Right.
Right? Like that makes it really hard because then
It
you're like
does.
awkward and not really sure what to do. So just like being around other parents, La Leche League, if they're operating in your area, has group meetups. You can go, you can sit, you can watch. That can be really, really helpful just to like understand, because even if you're not like learning per se, you're
Mm-hmm.
seeing it, right? And
Right.
like your mirror neurons are firing in your brain, like, oh yeah, I remember this person sort of holding them like this or doing this with their arms, or oh, they're not actually as fragile as you think they are,
For sure. I think
Yeah,
that's a big shocker for people who haven't held babies before. It's just
yes,
how
how
like
unfragile.
you
That's
can really kind of appropriately throw them
yeah, yeah,
around.
yeah,
Like
yeah, yeah. Don't actually, don't like kind of, and you don't really realize that until you have more than one baby, and then there's a
yeah, and you
toddler
have to,
interacting with the
yeah,
baby.
you're yeah, right. All the juggling. Yeah, for sure.
Yeah, yeah.
It's amazing.
Um,
Yeah. So I if there's like one thing that you can tell anybody about feeding, their breastfeeding, feeding journeys in general, what's like the one thing that you always want to drive home with people in that?
oh yeah. Just be open to how it goes.
Yeah.
Be
Yeah.
open to how it goes, because especially if it's your first, like you've never done this before. But even if it's not your first, you've never done it with this baby before. And
Which can be so different.
so different. It's so
Yeah.
different babies have different personalities from like the moment they're born, and you say that and you're like, yeah, whatever. And then you have more than one kid and you're like, no, but for real though. Like they're different. They're
For
just
sure.
different. And so you have to like be open to like learning them and learning, and like maybe especially like I know in the States combo feeding is very common, or like breast milk by bottle is very common. So
Yeah.
you might have your first baby where they're like this bottle is totally fine and I'm good with it, and you're like I'm prepared, and then the second baby just like will not take that bottle.
Right.
And like it's
Yeah.
or gets
It's
suddenly gets very
hard.
gassy, or like whatever, like just
Yeah.
different babies are going to be different, and you just have to like lose the perfectionism and just be open to like how things progress.
Yeah. Absolutely.
Yeah.
What are some of those ways that you help moms like rebuild that, maybe like that trust in themselves when their confidence in this is like, okay, like I thought I knew what I was doing, but now I have no idea what I'm doing.
Yeah, 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 yeah. I mean, a lot of it is because it's there. Like as
Yeah.
long as they're like maybe they are second guessing themselves, but the vast majority of the time, like your instincts are good. And
Hmm.
one of the things that I often tell people, and I keep meaning to look up this study because I don't know, I don't have a reference for it, but this was something that in a pediatric class I took when I was in naturopathic school. They mentioned that like one of the best predictors of a baby having an ear infection was the mom thinking that the baby had an ear infection. Like not pulling at their ears, not a fever,
Interesting.
not red cheeks, whatever. It was the mom being like, this baby has an ear infection. It's like one of the number one predictors of an ear infection, right? And it's just because you put in the time, right?
Yeah.
So if you are going to be with somebody 24 hours a day for days and days and days and days and days and days and days, and even
Hmm.
if you're going back to work, you're still with them like 16 hours a day, and babies are awake
Right.
for a good chunk of those.
For most of the time.
Yeah,
Yeah.
yeah, yeah. Like, yeah, you're just, maybe you don't know now, like when your
Yeah.
baby's 3 days old or 4 days old or 5 days old, but you will. You will. I promise you that, like, if I'm doing a follow-up visit with you in 3 months, you're going to be like, oh no, the baby doesn't like to be held like that. Like, don't hold them like that. They prefer this, you
Yeah.
know? And I won't know that, but you will, you know? Um, and just like giving grace to yourself, right? Because they are a stranger to you when you meet them, but you will learn them very well.
Yeah, I think that's so good. And I think so many people just need to hear that innate instinct is usually for the majority of the time leading people in the correct way of like, you know your baby, you know how to take care of them well. And like, yeah, there's other resources that if you need support with, there's out there. And also like you know how they react to things. And like I feel like I see that I have an in-home daycare as well, and my husband was an educator, so like I see kids in all different types of
Yeah.
walks, and
Yeah.
I feel like sometimes as like other caregivers, like a nanny too, like other caregivers, you see things, you pick up on things that kids do, and I'm sure
Yeah.
like you do in your profession as well.
Yeah.
But then but their parents like still like know
Know
them
it better.
so well,
So much better.
and that's really important to remember as a parent that like it's okay, like you know
You
exactly
know.
what they're doing.
Yeah. And like again, like don't discount the number of hours that you've spent, right? Like you are an expert. What is it, like
Right.
10,000 hours or whatever to become an expert in something? Okay, like how many hours in a day? How many days are you spending with that baby? Like you're getting pretty close pretty quick, you know?
Yeah, for sure.
Uh,
Absolutely. Especially when you're up all hours of the night
yeah.
sometimes.
By the time you get to a toddler, you're a certified expert in that kid. But
Yes,
then the next one is
absolutely.
different, right? So,
Yeah.
yeah.
What do you how do you like to support families and moms emotionally as well within, other than just helping them realize that they're doing things well
Yeah.
as best, like what else do you do?
I mean, part of it is like setting expectations.
Yeah.
Setting expectations, managing guilt, like diving into that a little bit, talking about that. Uh, I am always doing like a mental health screening when I'm with people.
Yeah.
Ruling out like postpartum mood disorders is necessary. And sometimes too, like you just even if someone's like, "How are you doing?" Like your doctor's like, "You doing okay?" You're like, "Yes," and then that's it. But like I only do home visits in my practice, and my visits are like my initial visit is 2 hours long. So I'm,
Yeah.
like, there for a long time. We are talking about a lot of stuff, and so you get a sense of, like, okay, like, yeah, maybe you said you were okay, but, like, are you really okay? And so, referring when needed, supplements, that's where, like, the naturopath hat comes in,
Yeah.
herbs and supplements, and then, like, lifestyle things, right? Like, people forget how important it is to, like, have a shower and change your clothes,
Hmm.
Like, go outside for 10 minutes, even if 10 minutes is all you can handle. Like, those things are so important, and we forget.
Absolutely. So, yeah, I appreciate the way that you do this because I feel like sometimes, and maybe you can correct me if you feel differently, but I feel like sometimes if you go any type of practice that I've gone to, like those postpartum screenings, like they hand you a piece of paper in my
A picture
experience
spreadsheet.
and fill it out. And I'm like, I know enough to know that if I'm trying to like show that I'm not experiencing these things or like trying to like be like, oh no, like I am fine. Like I'm
Fine.
okay. Like
Yep.
it's not really that big of a deal.
Yeah.
Then like then I know how to like circle those answers to skew that. And like that
I
sounds
think of it how
crazy
to think
saying
through.
that out loud.
Yeah.
But being able to like be like, okay, no, like there are these resources of people who are spending hours with you, and like there's only so much time that you could be like, no, I'm fine in a like 2 hour period that
Yeah.
somebody's there
Yeah.
helping you, supporting you. Because at some point you're gonna be like, I need to go to the bathroom, but I don't know how to like get up and walk away from the baby or whatever.
Yes. Yeah, yeah, or,
Yeah,
like, you get to see what the support system is really like in the
yeah.
home. You get to see, like, how if I'm doing a physical exam one of the best parts about my practice, if I'm, like, talking to students, I'm like, "I actually don't do that much of a physical exam of a baby." What I do
Yeah.
is I observe, because if you observe a baby feeding, you're gonna see, like, all of the innate infant reflexes at work, like, where they're supposed to
Mm-hmm.
be. You're gonna see their tone, you're gonna be able to do, like, a good vital check on them with, like, very little, like exam. You know what I mean?
Yeah,
Like,
yeah,
you
yeah,
can
like physical
hold
touch.
them and
Yeah,
watch
yeah,
them, and
yeah,
but then you get to see, like, how does the parent respond if I'm picking up and holding the baby, to, like, see what they do. How is the
yeah.
parent responding? Like, how are they, like, are they okay with it? Are they like, "Yeah, no, it's fine." Or are they like, "Oh my god, is the baby okay?" How are they, like, during the feeding? Like, how comfortable are they holding their baby? Like, all of
Mhm.
those things are it gives you, like, a lot of information. It gives you a lot of information.
Yeah.
I love the type of practice that I do.
Yeah, that's so good. Do you often meet with people beforehand as well, like before they're giving birth, or are you really meeting with them when they're like
Not
newly
as much as I
postpartum?
would like. I feel I
Yeah,
feel like because a lot of times people don't know until they know. My company, like, does offer doula services as well, and we do touch a little bit on breastfeeding in our, like, prenatal consults, but a lot of the time
right,
people are like, "I only have so much time. I only have so much, like, workplace benefits that I can use to pay for this stuff."
right, right.
And so usually I'm like, "Well, here's my phone number. Call me when you need me," and then I usually go later.
Yeah, yeah, that makes sense. I I just feel like I could see how beneficial it could be. Obviously, like if the stars aligned, that there were resources to do that, to be able to meet with people beforehand too. Yeah. Um, Hey, I'm just popping in real quick to say make sure you're subscribed to the Cyclical Doula podcast on whichever platform you're listening to, and don't miss upcoming conversations. If this episode is resonating with you, please share it with a friend, rate it, and write a review. This is how this movement grows, not through algorithms, but through women talking to women. All right, let's jump back into it. As we're talking about all of this, I would love to know just like a little bit more about you. And is there something of like a rhythm or ritual that you just love as an individual or a practitioner, as a mom, that in the seasons of life?
Like, different seasons of life, or do you want me to
No,
go back
like this
to
one. No, no,
this
like
one where I am
now,
now?
today. Yeah.
Oh, yeah. It's interesting because I feel like a lot of it is about, like, using what you have available to you. So, like,
Yeah.
I do home visits, and I find so much value in doing home visits for the type of work that I do. I
Hmm.
genuinely don't know that I could do what I do in a clinic setting.
Yeah. Yeah.
Um, but that means I spend a lot of time in the car. So then,
Yeah.
like, taking that time and, like, what can I do with that time? So, like, I have playlists that I have. So depending on my mood, right? I have, like, playlists, I have podcasts, I have educational stuff that I'll do. So I have this, like, beautiful protected time where I'm driving,
Yeah.
usually during the day. So there's, like, not a lot of other people on the road. There's no kids in the car with me. It's just, like, me listening to whatever I want to, like, decompressing, learning
Hmm.
something maybe. And I actually, like, as much as it's maybe not great for my posture, I really love that time of, like, in between where it's, like,
Yeah.
forced resting almost.
Yeah. Yeah. That's so good.
Yeah.
I think like it's so helpful. And I think we were talking about self-care earlier on. And I think that like finding those things as a parent that you can do for yourself to either like stimulate your own brain or like do something different, talk to another adult, or all of those things can be so helpful.
Mhm.
And so it's good to hear. I love hearing other moms' rituals just because it's like, oh, like that's a cool idea, that's a fun idea, or like, yes, I experienced that as well, and so yeah, it's so good. Thanks for sharing that.
Yeah.
What else as you've gone through your experience working with families, do you feel like things have changed with how you work with families as you've become a parent and are in different stages of motherhood?
Yeah, I mean, I was pregnant when I started,
Yes. Yep.
and so, like, it was I've done this at the same time. I find a lot of
Yeah.
lactation consultants are like, "And then I really struggled, so then I went and trained to be a lactation
Yeah.
consultant." It was watching other people struggle that, like, really put me into the path that I'm in.
Yeah.
But I feel like you get the perspective. And
Mm-hmm.
probably it's the perspective that I thought was super annoying when I was like really in it with my kids, where you're like,
Yeah.
why are you telling me it'll get easier? It's my whole life is going to be like this for forever. I'm never going to.
Yeah.
But like truly, your children grow up and things get different and maybe not always easier, but certainly it's not going to be 24 hours a day physical contact all the time. Like there is going to be
Mm-hmm.
a time where they're going to be like, I don't want you to hug me when you drop me off at school,
Yeah.
and it will be soul crushing for you. And so if
Mm-hmm.
your newborn wants to sleep on your chest, like that's probably fine.
Yeah. Yeah, for sure. I think I would agree that like so my kids are 4 and 6 and
Okay.
my daughter who's 4, she was a hard baby. She
Mm.
screamed the first 5 months of her life, which was rough. Um but I remember in that time frame that one of my mom's really good friends, who's a dear person to me, I remember her being like in the same space as us and her looking me in the eyes and being like, Emma, this is not normal. And like, just know, like, you are not going crazy. Like, this is not the norm. Like,
Yeah, this
so
baby
like
is
just like
truly
this
fussy,
baby
like,
is like
this is
needs
yeah,
help in
yeah,
the sense of like you're
yeah,
doing all the things and like keep doing all the things, but like just like know that and
yeah,
that's
this is
that's been
hard,
like
right?
reassuring to me
Yeah,
coming out of that. Like in the moment I was like, yeah, whatever. But like coming out of that season, I like it always sticks with me that I was like, it was so helpful to have other people who had been parenting for much longer than I have. Cause again, she was my second. Like my first was he was really easy. And for people to just be like, no, like this is like
truly hard.
abnormal. This is not just like who she is as a person. So yeah, it's helpful. So if you're listening to this and you're in a season of just feeling like that overwhelm, for sure, it does get easier. It changes, and there's hard times in parenting whenever. But man, it sometimes it's rough, and then also there's sometimes that it's so easy, and you can like live in that joy too of that and be fine with that too, and
Yeah,
that's
and
helpful.
one of the things too, I feel like that I realized as my kids got older is that you can love your children and hate the stage that they're in. Like
Mm-hmm.
3-year-olds, mm-mm, nope,
Mm-hmm. Mm-hmm.
no.
I feel that way about 4. I was telling another doula friend recently. I was like, I literally like 4 is my least favorite age so far.
Interesting.
Like,
3 is my least favorite age for sure. I feel like
yeah.
by 4 there starts to be like a small amount of reasoning that can happen, and
Mm-hmm. Mm-hmm.
I'm like, "Okay, this is fine." But 3-year-olds are articulate and then completely nonsensical, and then just
Yeah.
doesn't work in
Yeah.
my
Yeah.
brain.
Yeah. Exactly.
I
There's like
find it
too much
very frustrating.
synapse happening in their brain, and then also at the same time they have no idea
And
how to say anything.
I truly disliked parenting both of my children when they were
Yeah.
3, and that
Yeah.
doesn't mean that I don't love them very much.
For sure, absolutely. I think that's so helpful to hear just like again, like as parents, like it's just helpful to hear, especially early on, that like you can really love your child, you can really love your baby and also like really dislike the newborn stage or really
Yeah,
dislike
and
3
I
or
think
really
it's hard
dislike
because
4 and like
the
that's totally
newborn
fine.
stage is the intro, right? It's the first, so then
Yeah.
you're like, "Oh my god, do I just, like, not like my kid? Like, is this gonna be forever that I'm gonna feel like
Yeah.
this?" And it's like, no, like, it changes and, like, the whole relationship changes and they change as a person. Like, they're an inert little lump when they're when they're
I
newborn,
know.
and then they grow into these whole people, so, like, it's gonna change. It's not always, and it's okay to not really like it that much.
Yeah, yeah. I think that's really helpful to just hear. And I think as parents, excuse me, I think as parents, we have this time of just like feeling, I guess maybe that like mom guilt that we were talking about earlier on. And like, it can feel like we second guess ourselves so easily. And I appreciate that there's people out there like you who can just help women in these different stages of being able to be like, okay, like, no, like here's things to help. And also like, here's how to get through it too.
And I almost always tell people they're doing a good job. It's like one of the last things I make a point to be like, when I'm closing up my visit, like, I want you to know that you're doing a good job. And people usually like weep.
Yeah. Yeah.
Yeah.
Absolutely. Absolutely. Those postpartum hormones can be
Yeah.
rough in itself, which I think like I had a couple people recently be like, "Oh, I'm so sorry. Like I think it's just hormones of like them starting to cry." And I'm like, "Okay, like, but like it's okay. Even if it wasn't and you were crying, like that would be okay.
That's
Like that's
also
fine."
okay. Yeah.
Absolutely. What else do you want people to walk away from this conversation with? I know we've touched on a bunch of different things, but you can take as much time as you want.
Yeah, I mean, I think just like having grace for yourself, giving yourself time to like learn and grow and make mistakes and like not be the, perfect mom that you'll always be a perfect mom until you have kids, right?
Yeah.
And then you just grace and like make mistakes and that's okay and learning along the way and get support early and don't be afraid to get support and as much
Mhm.
support as you need, whether that comes in the form of professionals or just like calling other moms in your circle. Like I know, for me, if I have friends who have young babies, I'm always like, I'm gonna bring food. Do you want food? Like, can I do your laundry? Like and people often
Yeah.
like, no, it's okay. You don't have to. I'm like, no, but like accept it because you're in a season of needing more help. And so you like take it as an opportunity to learn how to receive. And then later, because my kids are 4 and 8 also, like now I'm in a place where I can give a little bit more, you know,
Yeah, right.
and it comes
Absolutely.
around. It comes back around.
Absolutely. Yeah, I think that's so good. So helpful of just like being able to receive the things that people are giving to you and you can hold boundaries with them, but also just like be like, here, like, yeah, bring me food. That's helpful. That's good.
Yeah.
That's
You
so
can come
good.
over, but you have to do my dishes when you get
Yeah.
here.
Yeah, exactly. That's so good. I think sometimes being more blunt about our needs is
Yeah.
so important of how we can do that. Absolutely. Well, thanks so much for sharing just a teeny tiny bit of, I'm sure, your expansive wisdom and knowledge. How can people connect with you?
Yeah, so I am in Toronto, Canada. Our company is called Your Downtown Doula. You can find us on Instagram and Facebook at Downtown Doula TO, and I think we're also on TikTok with the same handle. I'm not on TikTok, but
Yep.
I'm like scared of it a little bit. At Downtown Doula TO, and then online at yourdowntowndoula.com.
Awesome. That's so good. We'll put all of those things in the show notes and be sure to follow Sarah to learn just more about her practice and what she's doing. And thanks so much for being here.
Thanks so much for having me. I really appreciate it.
Absolutely. Thanks so much for being here today on the Cyclical Doula podcast. If this episode resonated with you, the most powerful thing that you can do is to share it. Send it to a friend, text it to your sister, forward it to that group chat. This is how conversations about our bodies start changing. Quietly, organically, woman to woman. If you are listening and thinking, okay, I want help applying this to my cycle, I offer free cycle clarity calls. It's a relaxed conversation over Zoom where we talk through your goals, your charting practices, and what kind of support that would actually make sense for you. You can book one at emma.com/free. And if you haven't already, make sure you're following or subscribe to the Cyclical Doula podcast so that you don't miss future episodes. And if you feel called to leave a rating or a review, it genuinely helps more women find this work. So thank you. You deserve to understand your body. You deserve to feel confident in your reproductive choices. And you don't have to figure it out alone. I'll see you next week. Thanks for being here.
Welcome to the space where cycles breathe, where the real raw life of a mama leads. From motherhood's highs to charting the low, your body's story is the